Hello and welcome to the GMIS digital series. My name is Buckwell. It's an absolute pleasure to be your moderator for this next session under the title of Health and Safety Reimagined, from factory door to the exit door, risk and compliance in a post-COVID-19 world. Safeguarding consumer and workforce health is one of the highest priorities amongst businesses and governments, and is now imperative for companies to plan and prepare for the future, especially when it comes to large-scale outbreaks. Institutions have put in place basic protection for their employees and customers, including no travel and work-from-home policies, as well as physical distancing at work. The industry is adapting by changing working norms and developing new norms to the physical workplace, as well as amending policies and regulation. So when it comes to risk and compliance, how can we plan ahead? Well, it's time now to find out through our fireside chat with two very special guests. It's an absolute privilege to have here with us today Mr. Bernardo Mariano Jr., the Chief Information Officer and Director of Digital Health and Innovation at the World Health Organization. Bernardo is responsible for setting and maintaining the vision and direction of WHO's strategy of health in the digital age. As CIO, he ensures that the digital transformation of the organization enhances its collective performance and efficiency to deliver the health for all global development agenda. Prior to joining WHO, Mr. Mariano held senior managerial positions in the International Organization for Migration as Senior Regional Advisor for Sub-Saharan Africa in the Office of the Director General, Chief Information Officer Director of Information and Communications Technology, and Regional Director for East and Southern Africa. A very warm welcome to Bernardo Mariano Jr.
Thank you. Thank you for having me here.
We're very much looking forward to your take on risk and compliance in a post-COVID-19 world. Thank you so much for being with us here today. Our second special guest is Professor Richard Clegg, the CEO of Lloyd's Register Foundation, which is an independent global charity with a mission to enhance the safety of life and property and to advance public education. The foundation is a major global supporter of science and engineering related research, skills and education, public outreach, and accelerating technology to application. Now, prior to the foundation, Richard had a very strong scientific background in industry, government, and academia in the civil defense and nuclear sectors. He's also a fellow of the Royal Academy of Engineering and sits on a number of boards and senior advisory committees. A very warm welcome to Professor Richard Clegg there.
Thank you very much, Laura, for the invitation, and really looking forward to the fireside chat with Bernardo.
Well, really fantastic to have you here for the digital series. I thought we'd maybe start off with what the post-COVID-19 world might look like when it comes to manufacturing plants and factories. And is it possible, do you think, as well, for the international community to develop a unified vision for the future of health and safety? Bernardo, why don't you start us off?
Thank you. Certainly, if we go back to the history, and if you look at the end of the Second World War, the whole world learned a lot of things, and a lot of institutions were created. And I think from the Second World War to now, the focus was wars, to avoid wars, nuclear wars, and others. But we didn't pay enough attention to health. And I believe and I hope that post-pandemic, we start taking investment to healthcare as something that every government and every institution has to take very seriously, because it shows that the impact is broad. It doesn't matter where you are. It doesn't matter if you're in a country that has a good health systems. A virus such as COVID-19 can impact everyone. So we owe to ourselves, to the next generations, to make an investment, create systems, bring better early warning systems, and create an environment of trust that health data and health systems can operate at its full potential, both in normal situation, but also in crisis.
I think that can be developed for the future of health and safety then.
Thank you very much. We are in need of a global vision, undoubtedly. COVID has shown us that the risks facing humankind don't respect geographical borders, and we live in a very complex, interconnected world. So it's not a regional problem or a national problem, safety, it is solutions. The question's about COVID, but it's worth just standing back for a moment and from a sort of a Google Earth position, just looking at when we talk about global health and safety, just try and, click the shutter and have a picture of what this looks like. Every year across the world, 2.3 million people die from occupational accidents or work-related diseases, and that's about 1 every 15 seconds. So just in my introduction now, somebody somewhere in the world has died, and as I go on, another one and another one, and 2.3 million people a year. And it's not just the human cost, that equates to around about 3.9% of global GDP as well. And it's not just a developing nations issue. Many geographies in the world that have seen an improvement over the years and decades in major accidents and fatalities are now seeing this kicking back up again and bucking the trend. So there is something going on. And in terms of the vision, what we do need is a technology shift in safety. We need international regulation, we need international codes and standards, but we also need this technology shift to enable safety. And perhaps one of the things that we may come on to talk about in a moment is this notion of safety tech, which is about harnessing the fourth industrial revolution and digital technologies and applying them to safety on a global scale, and the benefits that can flow from that. But perhaps we'll come on to that in a moment. I should say perhaps as well that you talk about a global vision, and there isn't a single vision. We can't see the future, and predicting the future is only as good as our imagination. And things happen, and COVID has shown us this, things happen that we never imagined. And combinations of events unfold that we never thought that would happen in that sequence. And whilst we need to try with foresight to look into the future and look over the horizon and see what might be coming next, we can't in a deterministic way prophesy what that future is going to look like. And therefore what we do need to do alongside all of this is build resilience into the critical infrastructures that societies rely on, whether it's energy or food or transport, whatever it is, and making sure that those infrastructures are resilient in the way that they're designed and the way that they are operated and maintained, so that when things do happen to them and they do get stressed, whether it's a pandemic or an economic stress or just a world stability stress, whatever that stress is, that these infrastructures can absorb that stress, recover, bounce back and learn.
Some really shocking statistics there, and I suppose when you throw in a global pandemic as well, the figures can only, I suppose, get worse unless something's done. So given there's no standard solution for operating a factory as well throughout a pandemic, there's no doubt we obviously need to rethink how factories and manufacturing plants operate as well. So what sort of new set of safety standards and health strategies do you think need to be put in place? And does one size fit all? I know you said earlier, Richard, that it doesn't when in terms of a sort of global outreach and a global overview. But in terms of sort of the future of factory floors, do you think there's one size that fits all when it comes to health and safety and this new normal? Bernardo.
Yes, certainly. I mentioned trust in my early intervention, mainly because trust means that you need to develop that trust environment within the ecosystem. meaning that yes, they are global players, such as the International Labour Organization that brings together in a tripartite environment the employers, and the governments to discuss some of the policies. We have the ISO standards that guide these health and safety standards in factories, but we need to enlarge the ecosystem to make sure that what we learned today, as Richard said, we apply, but also we already start using technology to accelerate the transformation. Because when you look at the digital health transformation in the health sector, it is behind many other sectors. Behind the media, it's behind the financial, it's behind a number of sectors. So we need to raise that, accelerate, because after all, and what pandemic is showing us, the health of our workforce is key to the profitability of companies, is key to development, and is key to the well-being of the people. The pandemic is showing us the impact is just enormous. Look at the small, medium enterprises. I mean, I think if we start looking at the statistics in every country, in developed countries, you have, of course, the governments giving incentives or giving bailouts. In developed world, that doesn't happen. So if on the factory floor where goods and products are started, the manufacturing cycle in developing countries, so the impact is going to reach the whole globe. So we need to build that trusted ecosystem where we take the lessons from pandemic, we look at the technology, and how do we build the resilience, as Richard said, but then how can we have some sort of an early warning system to allow companies, private sector, public sector, to actually adjust early enough before we get into a situation similar to the situation we got with the COVID-19 pandemic.
So Richard, let's talk about these groundbreaking technologies of AI and big data and what sort of role they're going to be playing in the future as well.
I completely agree that we are entering as the world the fourth industrial revolution, as some people call it. The first industrial revolution was steam, the second was electricity, the third was electronics and the computer age, and now we're entering this fourth industrial revolution era of the Internet of Things and artificial intelligence and robotic and autonomous systems and big data. And all of these bring benefits. They also bring with them risks. And we need to harness that technology for the betterment of mankind and to make the world a safer place. As a foundation, we've done a piece of work to try and have a look at what the marketplace might be, the global marketplace for these fourth industrial revolution type technologies, applied specifically to safety. And we call it safety tech. And it's very much, just to help people understand, it's very much like fintech in the finance sector and meditech in the health sector, but this creating this new market of safety tech. And it's independently estimated that this 2023, which is only around the corner. Now, to me, that's a very big number, and it's something I would love to see these technologies get harnessed, because if that market can be worth $863 billion and it happens, then the world, to me, is $863 billion safer, right? And so the question is, well, what is this? What could be done to harness these technologies? compounded annual growth rate of 28%. So we're going to see the application of wearables. This is, you know, functional textiles and things like this that are going to make the world safer. And everything is going to be aided by this Internet of things connected together. We need to fast track these technologies for applications. But everything comes at a price, so these do carry downsides as well. There are risks associated with these technologies, and we must anticipate those as well, and make sure that when these technologies do arrive, and they are finding applications, that they do arrive safely.
Because that was one of my questions actually. So Bernardo, when it comes to SMEs, because we mentioned SMEs earlier, how can these types of applications also be made more available to SMEs when it comes to health and safety? Because financial pressures are always of great concern, I suppose, when it comes to SMEs. So what can be done to sort of make these more available to them?
I think we have national mechanisms, but also we have global mechanisms. Currently, with the COVID pandemic, there are I think some great initiatives that are global, some excellent initiatives that are national to really strike the right balance between the public health security, the economy, and the social impact. But I think we need to do better work in making sure that SMEs that are in a disadvantaged geographical location because of either the economic development of the country or otherwise are not decimated, basically, because of the economic impact of the pandemic. So global mechanisms such as World Bank, IMF, and other financial institutions owe to all of us, to the whole world, to ensure that the economic impact of SMEs across the world is minimized, same way it is being minimized in developed countries. From WHO perspective, we want to make sure that the lessons we learn from this pandemic are duly implemented and improved to ensure that next time or even the next cycle we do better. But I think this pandemic has shown this close interlinkage between health or health security, economy, and social factors. So how can we strike the right balance to ensure that as we navigate through the next pandemic, or as we navigate through the next cycle of the same pandemic, we minimize that impact. And we are creating a global, we call it a network of networks, to bring multi-stakeholders to try to understand how we can together, with the solidarity, bring about transformation of the healthcare sector, but also a better linkages with the economy and social determinants to ensure of health, to ensure that as we make decisions on public health security, the impact of the economy is considered in a way that one does not kill the other. Because right now we have a situation where in some countries you enforce a lockdown, and somebody in a developing world that has the cash flow for a month as an SME, if there's no incentive from the state, then that SME will basically not be able to survive. So I think that we need to break the silos, understanding that in the healthcare sector there's a traditional silos culture, even at national level. So there's a lot of work to do, even to break the silos within the health sector itself. But I think we need to cut across to make sure that from health to economy to social, we do a better job than we've done so far.
There, of course, there are going to be some devastating results for the SME community. So maybe, Richard, you could tell us a little bit more about the importance of collaborations and partnerships right now as well, especially when it comes to this new groundbreaking technology and 4IR, for example, as well.
Yeah, I think just to build on something in a moment, I'll come back to the question in a moment, but just to build on something there that Bernardo said, about learning the lessons from COVID, and this comment I'm going to make leads into answering the question, Laura. Bernardo was talking, about learning the lessons from COVID, and our response to COVID from a technology point of view is quite primitive. And we're looking at things like social distancing and lockdowns and a bit of testing and some training, and those interventions really are quite blunt and centralized, and as I say, in the scheme of things, quite primitive, and a lot of the improvement that could be made go into this area of these technologies that we've been talking about, these fourth industrial revolution technologies. If we had better data, better shared data, we would have better insight. With better insight, we can make better interventions, and it takes us into this realm, the question that you're asking, Laura, of to develop these tools, and to share all of this data that is just being, the digital university is growing, all the time. What we do need in terms of international collaboration is, mechanisms to be able to share this data for epidemiological studies, and developing AI tools to look for patterns in that data. This is an international challenge requiring international solutions, and that's where the collaboration needs to happen. And just to pick up on a couple of points without labouring them, that Bernardo also made, alongside all of this, we have to have trust as well. Trust in this is public trust. Trust in the people that are going to be using this data. The trust in the science, trust in the technology. It's about public understanding of risk and tolerance and understanding. And a lot of these breakthroughs that are going to be needed in the technology sense are going to come from SMEs as well, which was a good point that Bernardo made as well.
So what do you think in terms of IT teams and CTOs and their role? Do you think they're going to be playing more of a pivotal role in the future as well, post COVID-19 as well? And what about previous HSE manuals as well, pre-COVID-19? Are they going to be more or less obsolete from now on? What do you think to that, Bernardo?
I think from the CTOs and CIO, they have to come out of their dark room and the back office too, because now I believe that technology is the business, and then it's not just a service, so it's not just a good engine room that runs the business. It is the business. So I think we need to make sure that CIOs and CTOs, they come out of the dark room or the back office to make sure that they bring the value to the whole transformation. We are going, as Richard said, to the fourth industrial revolution, and digital is a key element. And if we want to make sure that we gain the value of this transformation, we have to look at the private security, but also we have to look at what is the impact on, if it's on safety and health and safety, what is the impact? How much the technology is bringing? How much value it is bringing to that particular change or of a new normal, if I can call it that way, post-COVID. But as well, we want to. I believe we have to ensure that the different sectors that have a niche advantage on either innovation or we need to come together in that ecosystem that allow each one of us to lean into each other's distinct advantage to accelerate the change that we need to implement. And crisis, I mean, to make the best out of a crisis is to actually create a transformation agenda that accelerates some of the things that we have been very reluctant to develop. I mean, I can give you one example: telehealth and telemedicine. The technology is there, policies are not there to really leverage on the potential of telehealth and telemedicine to reach the unreached, but also to make sure to develop in such a way that we are, if we have a next pandemic or have a next situation similar to this, we are able to quickly address issues such as, for instance, just mental health. Now you have the pandemic, but from the workforce perspective, you have the mental health issues that perhaps the real picture of the impact on mental health will be known a couple of months from now. But that will impact the economies as well. It will impact companies and the different sectors because of the COVID-19 lockdown and that impact is. If we had telehealth, telemedicine, we could actually minimize that. So there are areas that the technology is already mature enough, and understanding that there are technologies that we need to mature, we need to look at privacy, security, and ethical issues. But we can do better, and we can better leverage on technology to really maximize results, maximize output, maximize profit for a private sector company, and to ensure that we are better prepared. And preparedness is key for any other change in our ecosystem, be it a virus, be it something else.
Do you think that type of technology, the telehealth, is something that might come online quite quickly, quicker than it normally would if there wasn't a pandemic?
If there wasn't a pandemic, I think we'll be still discussing challenge of telehealth, telemedicine. There are countries that are from one state to the other state, you can't, medical doctors cannot use telemedicine. No countries allow telemedicine to be used across border. And yet, if you think of what happened during the pandemic, what is happening, health systems collapsed in countries that had traditionally what we consider good health systems. And yet the country next door couldn't support the country that was just facing a high demand, an increased demand on their health system. Of course, we have also other diseases that were impacted because of COVID-19 response by countries. And telehealth, telemedicine could have supported that. So we in my view, I think we should, as governments, the private sector, and academia, and public sector, we should accelerate the use, adoption of telemedicine and telehealth to fully utilize the capacity of health systems to reach beyond the geographical location or a state location, and actually contribute to lower the mortality of some of the diseases that require specialists that are for people that are in areas that there are no specialists, such as hepatitis C. Somebody in a developing country, in a small village, this hepatitis C might kill the person just because there's no specialist nearby or in the province. But yet telemedicine and telehealth, as well as artificial intelligence, could actually support and allow an intervention early enough to treat such a patient. So I think we have to embrace technology, taking all the safety, ethical, and security consideration, but to embrace technology to drive the transformation, accelerated transformation of digital health in the healthcare sector.
So it seems that it's a sort of like a government level. Things need to change at government level so that policies can change, so that can be rolled out. What are your thoughts on that as well, which I'm sure you'd like to add to that?
Yeah, I'd like to just build on some things that Bernardo said there, and particularly, about, do we need changes to HSE manuals and the likes. I think that we are in need of a paradigm shift in the way that we think about and manage risk and safety. What I mean by that is that COVID has particularly showed us the impact of tail risks, risks that are many standard deviations from the mean or the median, high consequence but low probability type events, which are quite frequently disregarded in the boardroom. This paradigm shift that I mentioned, the traditional way to date of thinking about risk is to take the system, whatever the system is, and to imagine all the events that could damage the system and combinations of events, and you attribute risk, and then interventions are designed that either make that risk go away or just reduce its impact. And that's a traditional way of thinking about risk. And then what happens, and COVID has shown us this, is that things happen in the real world that we hadn't planned for, called them black swans. And I think a much better way, a supplementary way of thinking about risk is to think, well, the worst is going to happen, and to build resilience. It goes back to my point at the very beginning, is to not just put up with black swans, but to build resilience into systems so that no matter what hits them in the way that they've been designed and operated and maintained, that they are going to be able to absorb and bounce back and keep themselves safe, no matter how they are stressed. So I think HSE manuals need to change in that respect.
There's been talk of a second wave, as we mentioned earlier. So how do you think we can really plan ahead? What needs to be done? And with so much uncertainty, how do you think the industries can also continue their operations without too many sort of disruptions? Because I mean, we've been through one wave. Let's say there is another. Surely we can be a little bit more sort of prepared the second time around, if that does happen, of course. Do you also think we maybe need to sort of reduce our expectations when it comes to production and maybe not put too much pressure on it?
I'd probably like to just build on that question, Laura, and perhaps just ask Bernardo, because Bernardo said a really, a very important thing a moment ago about, and when he was talking about telemedicine and that, about accelerating. That's a word that I sort of took into my mind, about accelerating the uptake and application of these technologies. And a lot of the solutions that we need for, to be ready and resilient or whatever for this second wave, do come back to this acceleration, whether it's coming from, good ideas from SMEs or wherever it is. And so I'd be very interested, just to hear further from Bernardo about how, what we can do, what needs to be done to accelerate, whether it's telemedicine or whatever it is. How do we accelerate these good ideas to application and commercialization if necessary?
From the WHO perspective, Dr. Tedros and the President of France, President Macron, as well as the President of the European Commission and Melinda Gates, they launched tools to try to build this accelerated interventions on vaccine therapeutics, health systems strengthening, among others. So that is one initiative, but I believe that for the second wave, I use the words of Dr. Tedros, test. So we need to develop rapid test kits. On the other hand, we have the industry, for instance, talking about or asking for some sort of a immunity passport. Okay, but the immunity passport, if it ever comes to light, it's something that is still putting a strain on the health systems to generate, to test, and then create that passport. But if with a rapid test, that can be available everywhere in all industries and every entry point in every company. So to make sure that anybody that is infected is quickly the contact traces are quickly traced, and the infection is contained as quickly as possible. So innovation around rapid tests with the wide availability is a key area that I believe that the private sector, public sector, and governments need to heavily invest, and that will impact tourism, impact every sector. So if we say no, let's ask the hospitals to contact trace the potential cases of COVID infection, we might reach the same situation of overwhelmed health systems. So I think we need to bring the role of testing to the point of entries, or to the point of, or even care centers, or even at home. So the capacity for an individual to say, look, I feel unwell, and maybe I can have a rapid test that is affordable and accessible to all, that can have the confidence to say, okay, I'm positive or not for COVID-19, and then take the necessary measure, because no one wants to infect anybody else if they know that they have the disease. So I think we need to prioritize in some areas. Testing is one that would support getting back to a normal. But that normal will never be the same as before. I think we will have a new normal post-COVID, and that new normal will take the lessons from the pandemic itself, COVID-19 pandemic, but also adapt and adopt new ways of working, and new ways of staying safe, new ways of health and safety at factory level, in new ways of ensuring that the production, the economy, the revenue, the outcomes are not as greatly impacted as they are today when we go to the next wave. But we need to work together to fast track and accelerate the access to COVID-19 tools, both from the epidemiological side, but also from the digital solution and technology side.
Well, yeah, as you said, the only sort of real element that prevails and is successful in these sort of scenarios and challenging times is innovation, isn't it?
Exactly.
Would you like to say a few final words as well? Because sadly we are running out of time. Is there anything you'd like to add to that, Richard? And then what we'll do is we'll do a quick sort of wrap up, maybe just a couple of sentences for some of the key takeaways you would like our audience members to go away with. So is there anything you'd like to just add on from what Bernardo just mentioned? Yeah,
I think just to add on to what Bernardo is saying there, that what we do need, and I said a moment ago, is accelerating some of the technology, particularly digital technology solutions to safety and in a post-COVID world. And I think you can say these things and you think, well, how do you make it happen? How do we get innovators and entrepreneurs to aim their solutions at the problem, and for them to be down selected and accelerated? How does that happen? What are the systems and what are the mechanisms that are in place to be able to bring together people who might have really good solutions with those that are trying to solve the problem, and accelerate things through that process in a technology accelerator sort of model.
So just wrapping up, tell us maybe some of the key takeaways that you would like our audience to go away with. What should we look out for in particular, sort of moving forward? Bernardo, why don't you start us off?
One element I think that's, I wanted to just stress is that for us to thrive in a crisis, we have to have been prepared. Even if the tool we're using right now to discuss, it was not created after the pandemic, but was enhanced and accelerated its maturity to respond to the many teleworking and virtual meetings environment. But it started earlier. So that meaning that if we want to be successful in health and safety in the factory floor, but also on health and public health security in the future, we need to do more on preparedness. So it's very key. Now, during the crisis itself, we need to ensure that innovation has a room to bring about solutions that are required now and right now. At WHO, we created the Digital Health and Innovation team, actually from the beginning of this year, which is the team that I lead. And we had to just shift gears into COVID. And innovation scale-up is one area that we have great challenges. So partnership to scale up innovation, that it's very key. You can even talk about innovation on vaccine, innovation on digital solutions, but the scale up is key. Today, many companies are racing towards the vaccine. The real challenge is how is the supply chain? Who gets first? Is how do you scale up the production to make sure that it reaches the whole world? So scale up of innovation at every level, I think, is an area that perhaps, in my view, we should take as a lesson, as an area that during COVID we should do better. But coming back to preparedness, early warning systems for public health, we should have better system for public health compared to weather forecasts. And yet today, weather forecast runs way better than public health security, way better, because I know that the typhoon is coming in a week time before it hits where I am. So we need to do better on public health security, especially on early warning systems for disease surveillance. That's I stop here, but understanding that yes, we are in the middle of the pandemic. We need to respond to it. We need to address the current challenges. But let's use the opportunity as well to bring innovation, to learn from it, but also to change some of the fundamental areas that need to change and which otherwise would be very slowly to change, but that we can fast track those changes. Thank you.
Extremely valid key points there. Thank you so much. And finally, over to Richard, what are your final thoughts wrapping up?
Yeah. My summary points from what I've said and what I've heard on during this conversation. I think of 4 or 5 things. The first one is about safety tech. This safety tech market. How can we create that market? How can we accelerate it? $863 billion within the next 3 years. And as I said, if we can make that happen, then the world will be $863 billion safer. So how do we deliver safety tech is my first point. My second point is around, we touched on the 4th Industrial Revolution, about aiming digital technologies, digital solutions at safety problems and challenges. We are data rich, but we're insight poor. My take-home point is all about we need better data, we need to assure its quality, and it needs to be shareable. How do we go about that? Codes and standards and protocols. Resilience is my on that things happen that we had never imagined. How do we build resilience into systems so that when we stress them, they will bounce back and recover? We didn't really touch on this very much, but only slightly, to do with regulation. You know, part of the solution is technology, part of the solution is social adoption of these technologies, but also we need international regulation. How do you regulate an AI system when you don't know what it's going to do until after it's done it? So there's a whole thing about international regulation, the future of regulation. And then my final point is something that Bernardo said. I think it's a very important thing to end on, is about mental health. And when we talk about safety and we talk about COVID, you know, we quite understandably talk about the economic hit, we talk about the human cost in terms of deaths, but there's a big mental health price to pay, and that's just going to grow into the future with the sorts of fourth industrial revolution technologies are going to come. So to end on mental health for me.
Fantastic key points there as well. Thank you so much to both of you for joining us and sharing your knowledge so openly as well, and taking the time out of your very busy schedules, I'm sure. Some top level guidance and impressive observations and solutions there on risk and compliance in a post-COVID-19 world for the GMIS digital series, which of course is leading up to the GMIS virtual summit on the 4th and the 5th of September this year. If any of our viewers would like to continue the conversation, please do head on over to our social media. That's where you can find us under at GMIS Summit. And also, please do feel free to email us. Please do also keep a lookout for the next GMIS session in this digital series, with a focus on globalization towards sustainable and inclusive global value chains. Thank you very much.